Okay. Hello, everybody. My name is Elizabeth. I'm the founder of Wazima Health. I would like to do a quick poll, please. If by show of hands, you could just let me know if you or someone you know has ever been or is affected by a non-communicable disease like diabetes, hypertension, cancer, and so on. Can I just see show of hands? Please look around. So it would give you an idea of the scale of the challenge that we are solving at Wazima Health. Up to 60% of those in sub-Saharan Africa that need care are either completely undiagnosed or poorly managed. Additionally, there is really limited access to early screening and diagnosis. When you marry these together, it sets the scene as to why non-communicable diseases, or NCDs, are said to become the leading cause of death in sub-Saharan Africa by 2030. The size and scale of the challenge that we're addressing is valued at about $430 million per year. What Wazima offers is a connected, integrated, remote screening, telemedicine, and health management solution. We provide access to early diagnosis, medical providers, medicine, support for continuous care. So in real time, patients are able to share their diagnostic reports and data with their healthcare provider, who is then in turn able to triage them or provide the necessary care. We are revenue generating already and EBITDA positive since 2021. We have served over 308,000 patients. We've had over 310,000 consultations. We have screened over 150,000 people. And of those we have served, we have 64% plus are women. So that in turn informs why we're not only sort of focusing on NCDs, but also women's health conditions. We have a number of partnerships. Our revenues to date have been generated through clients, over 110 clients actually. Our model for business is B2B2C, and we generate revenues through commissions, through subscriptions, and the sales of our screening devices.
Unfortunately, time is up, so we will follow with our question.
Thank you for your pitch, really important topic. Can you jump back for 2 slides? Because in the B2C model you said there's written sales of devices. Which kind of devices are you selling?
Right. Our devices are able to screen for sugar in diabetes, hypertension, ECG, temperature, and oxygen saturation. So what we would call sort of vital signs, the basic checks that you will have done at a hospital or clinic. But you can do this remotely, by the way, using our system.
Okay. I'm by no means an expert in the African market, so I'm just curious, how do you reach people that are living in rural areas? Because I think, how do they get to know you?
Yes. Sub-Saharan Africa has a lot of peculiar challenges. So we put our devices in the hands of locally trained healthcare nurses or healthcare practitioners. So they are able to serve their local communities because our devices connect by Bluetooth, which the nurses have access to and can provide the service.
And but as I said, I'm no expert in the African market, but isn't there a big problem in Africa that people have to commute long distances to the local nurses and doctors? Are you already?
It is. Africa has, in terms of ratio of medical doctors to patients, it's something like 1 to about 4,000 or 5,000. So the medical practitioners are really stretched. So having access to remote care is a massive need over there.
I think it's quite impressive what you have already built up. My question would be, how have you built up the network around doctors and hospitals in Africa, and then at the end built the connection between B2B and B2C?
Right, okay, we started our model, when we started some 5-6 years ago, it was B2C. So we had a collection of doctors we'd formed relationships with. But over the years, we've continued to grow partnerships, not just with doctors, but with nurses, pharmacists, the entire healthcare ecosystem, actually, including health insurance providers.
Thank you.
Thank you.